So my name is, for those of you who haven't spoken to me today, my name is AK Maheswaran. I'm an anaesthetist based in Leicester. I am the clinical lead for the Future Focus Finance programme. My background, I guess, I've been doing this for a few years now, and teaching about business cases. I've done the Better Business Cases kind of qualification / course, and I have an MBA. Just to give you a bit of, some background to why I'm talking about this. What we're going to talk about today is the generic kind of parts of the business case. There are every organisation will have its own business case process. So it'll have its own form and it'll have its own things that are required within it. But what we're going to talk about today is more about the kind of fundamentals that should be in every business case. The things that I know that your people that are looking at the business cases will be looking at, primarily because it's what they have to do. This is the content of this is based on what's called the Better Business Cases, or the 5-case model, which is what the Treasury have asked all public sector business cases to be based on. Now, the actual Green Book and that is much bigger and much more comprehensive, but it's often too big for the uses that we want it to be, in terms of it's designed for multi-million-pound business cases rather than the much smaller ones that we tend to be involved with. But the principles of it still apply. As before, feel free to ask any questions as we go along. We'll do some questions at the end anyway. I have got the chat on my phone, so I can see it today, this afternoon rather than earlier. I couldn't see it properly. Okay. The first kind of thing we kind of have to cover is what a business case is. Now, there are two kind of purposes of a business case. The first purpose is the one we probably know the best, and it's there are only finite amount of resource, and the business case puts forward your proposal to prioritize your business case over other people's. So that's the first thing. And so you have to, it's a bit like Dragon's Den, it's a bit like you have to make your point across. Now, I've had people come across to me and say, when we use this face-to-face, people say, well, my Royal College says we need to do this. The problem is that Royal College is nice. They come up with multiple proposals and different ways of working that require resources every year, and organisations don't have the resources to do that all the time, so they can't do it straight away. So you have to put forward what is the most suitable option for your organisation and show that this is what's best. And the other bit, I guess, is that the business case is retrospectively it shows the decision-making process and shows thought-making process as to why a particular initiative was used. Okay, and that's the other purpose of the business case, and that's why a lot of full business cases for bigger things are actually published online, because it shows the thought process behind the decision. Whether it be a merger of departments, whether it be a building of a new A&E or anything like that, it's a retrospective decision-making process. So the first thing when you're thinking about writing a business, or you have a proposal that requires a business case, is to understand the process, to know the process within your own organisation. Because there are normally various hoops you have to jump through and various people you need to get on board, and knowing that process before you start may save you a lot of time and effort. So, who needs to authorise this business case? And by that, it's quite important to know who you're pitching it to. Is it a business case that has to go through your trust first before it goes externally? Is it a business case that really ultimately needs to be authorised externally? Now, by that I mean by the commissioners, because if it's a new funding stream, or is it something that needs to be pitched to NHS England for the specialised commissioning? Is it something that's actually most suited to be funded by a training budget? Which budgets are you trying to get hold of? Is it a capital funding? Is it a revenue funding? Okay, so try and work out where, just get an idea of the process involved, which committees need to be need to approve it, and who sits on those committees, because that will help you in terms of getting feedback and buy-in, and do that early on. I guess the next bit is what needs to be a bit in a business case, and you have the who, what, how, when, where, why. All those elements of a business case need to be there. So it's really important that they're all in there. But it has to be in a structured way. So what we're going to use is the 5-case model. Now this is the, as I said, the public sector kind of preferred way of doing things. And we're going to go through these in a bit more detail. But you have the strategic case, your economic case, your commercial case, your financial case, and your management case. So that they're the 5 cases. So they're almost the 5 chapters that you need to go through. And no business case is a single person thing. You know, there may be one person that coordinates information, but you need input and help from various different parts of your organisation, whether it be finance, whether it be HR, and things like that. So you just need to be aware. There was an echo on the line. That's better. You just need to be aware of that you do need other people involved. So the first step is the aims of a business case. It has the options have to be desirable. So it has to be something you need, you want. It has to be viable. It's something that can actually be done and achievable. So realistic. Probably the biggest issue with business cases, and then probably the primary reason for failure, is that business cases that are written for a solution. So people have gone in to write the business case with the solution in mind, and it's very clear when a business case has been written with a solution, because that is the option when you're doing the various bits. That is the kind of option that's been driven through the whole process. Good business cases, and one that that succeed, are there to solve a problem. So if a business case is designed to solve a problem, so you have to show that there's a problem there that needs solving. Okay. Now, previously, in historically, I guess, business cases are also there as an income generation thing. So if you showed that you're going to generate more income, you could use that as a business case. But as those funding models are changing, the other way of another driver for business cases is to improve quality, and it has to be significant, as we saw about the value equation earlier. But think a bit about outside the box when you're thinking about the business case. Show the problem and then show the different ways that you thought about to provide a solution. Okay. And I'm going back to this equation again in case people missed it earlier. So this is the value when you're talking about improving quality. You have to have your quality over cost, outcomes, experience and safety, and your revenue and capital costs. So around your revenue, your day-to-day costs, your capital, your big upfront costs. And you have to show improvement in at least one of those 3 areas in terms of the green areas. And it's got to be worth the cost that you're going to put forward, the resource that's going to take. And that's how you show value. And that has to be shown clearly as a part of the business case. So I'm going to skip forward to this bit and then go back to that in a second. Now, there are various iterations of business cases, so you don't write the whole thing straight away. But one of the first things that you do, and you have to kind of do clearly, is you have to show that the strategic case, and that's you have to have the context of it. So what is your current situation? how does this business case align to the organisation's aims and ambitions? So your organisation will have values, you have some kind of goal, whether it's be the best or whatever your organisation's aims are. You have to show very early on how this business case fits into the grand plan, the grand organisational plan. Because if it doesn't fit into the grand organisational plan, it won't score as highly. They will always prioritise those business cases that align or clearly align to the organisation's ambitions and aims. So that's what we mean by the strategic context. The next bit, and again, this is another area that people don't put enough effort into. Okay. You need to make the case for change. You need to show why things need to get better, why you need to do something different. Okay, and use data. So you can use data from NHS benchmarking or any other benchmarking tools you have. Use input from your CQC reports. That they're quite strong, powerful drivers for change. The others are less so. So GIRF, they're getting it right first time. They will give you data and things that you can use. And model hospital is really useful. It's called the model health system now, but same thing. Use the freely available data that's collated to drive forward your ambitions, your projects. NICE or Royal College recommendations, mortality reviews or root cause analysis are all good sources of drivers for change. And there are simple drivers. So anaesthesis, desfrain is one of the drugs we use in anaesthetics. It's also a really, really bad drug for the environment. And this is data from my trust. So I took over as the kind of anaesthetic sustainability lead in August last year. So this is the data that I got from, this is straight off Model Hospital or Mental Health System, and it showed that my hospital is the blue is really bad at desfrain. And we were at kind of 20% of our inhaled anaesthetics use. Now the government target in the contract was 10% by April 2022. So you use that and go, look, we have to get it down. But one of the drivers that we need to get it down are more pumps or different types of equipment so we can use as an alternative to desfrain. So you can use this as a method, a driver to show change. Okay, and we've all got some funding from the CCG, from their sustainability fund, to buy some more equipment, and we've actually successful in getting it down to well below 10%. Another thing you can use it. So this is a length of stay for emergency appendectomies, and we're not very good at this. And then you can use other data. So then you can use, whether it's PLIX data or other data to show actually the reason most of our patients have a relatively long stay after emergency appendectomies is not that they actually have a long post-operative stay, they have a long pre-operative stay. And that's because we don't have enough emergency theatre capacity. So you can use that to drive forward your case for increasing the amount of emergency theatre capacity in your organisation. So these are just examples that that I've quickly looked at and done some data from. But it's about using the data to show why we need to change. So you have your current situation, we run one theatre, blah blah blah, from 8 till 8, and then and overnight for emergencies, but we cover X number of specialities, we have this much work, and this is our current data. We are well below the national average. So you can then use that as a driver for change. So once you've kind of got your case for changing, you kind of use your existing arrangements as part of that. And you explain what your current situation is. You also explain, when it says about business needs current future, it's about what your forecast of activity is. What's your current level of activity, and how do you predict it changing? So if your level of, say, let's talk about appendices again. If your level of appendectomies is been increasing by 2% every year, you can use that to kind of go, okay, well, it's probably going to increase by 2% next year, unless there are particular reasons why you think it's going to be higher or lower. And you've got to justify that. And then you go, okay, well, we haven't invested in increasing our theatre capacity for the last 5 years. So since the last time we assessed our theatre capacity, our activity levels risen by 10%, okay, or whatever it is. So you can use that to kind of look at your business needs. And then you've got to go by potential scope. Potential scope is what realistically looking at. You know, I'm not. This is not going to be a business case to deal with, you know, building a whole new theatre complex. You know, I'm not asking for 5 new theatres so I can run a whole load of emergence lists. What we might do is have, you know, an extra couple of theatres doing evening work. That might be a better solution. But this kind of looks at what kind of scope are you looking for. You know, this is what's going to limit what you can do. And what is the objective of the spending? So what kind of things are you thinking about when you're looking at spending? Is it going to be a staffing cost? Is it a capital cost? That kind of stuff. You have your benefits. So obviously you have to show those benefits, and what are the risks of doing whatever you're planning on doing, of changing, the risks of change. And are there any what's called disbenefits? So risks are things that potentially can happen. Benefits are good things, but disbenefits are bad things. So what are the benefits and disbenefits? Now, constraints and dependencies are much more. It probably does shape your scope, certainly. So what's going to limit what you can do? Okay, your constraints normally are logistical estates, normally. Maybe staffing, but most commonly estates. So there's no point saying I want to run 5 extra lists because we haven't got capacity for 5 extra lists. You can't say I want to run a you know, four outpatient clinics a week when you haven't got space in the outpatient clinics to run 4 outpatient clinics a week. So what's going to limit what you can do? Dependencies are other projects that are dependent on this project, on this business case. So commonly it's things like often you have different business cases of different aspects of a program. So an example, you might be putting in a business case for we had a business case approved for implementing electronic consent and electronic pre-op assessment, because we got some funding from NHS Digital. We want some bit of funding for that, and so we had a subsequent business case about the staffing and the kind of staffing resource that's going to be associated with that. Now, obviously, the implementation of that electronic pre-assessment and consent is dependent on us having appropriate staffing and IT support. So one is dependent on another. There's others where they've had a business case approved for building a new day surgery or some sort of orthopedic day surgery centre, but that's dependent on making sure you have enough radiographers to run or help run that side of things. So staffing based on a capital spend. So what's going to determine what's going to depend on your current business case? Okay. So in many ways, the strategic case is the most important because it's the bit where you're selling it. And then once you've got that, you can then start exploring the possibilities and your potential solutions. Okay, so I'm going to go back a little bit because we talked about different stages of a business case, and for small business cases and relatively small business cases may only go through the first stage, because actually you just do it all in one go. There's no point having various iterations of it. But if it's a bigger business case that needs either external approval or has to go to board or something like that, they might want you to do it in iterations where you go through the strategic outline case. And then once that's approved, then you go a bit more and you do an outline business case, particularly if there's lots of procurement involved. And then your full business case is more about dotting the I's and crossing the T's. So essentially, once you've got your outline business case approved, then the full business case is the bit of the retrospective analysis bit that shows your decision-making bit, and it's the final step before you kind of sign the contracts. Okay, so this is the kind of the way or the iterations that you do it for a bigger business case. Smaller business cases, and a lot of the business cases that we're directly involved with, we often don't go through stage. It's just one, whether it's a strategic outline case or an outline business case, you just go straight to one. Okay. And when I talked about the business's current future, one way of doing it is just like by doing demand and capacity modeling. Okay, looking at like I said, how much change there has been each year, how much you forecast the next year, and then looking at the total amounts and seeing when the last bit of investment was to show actually it's been X number of years, we've had this much change in activity since then. This is an example taken from another business case I wasn't involved with, from another trust. And again, this is you just do it in a slightly different way. You can show that the number of additional lists. This was for staffing. This was for radiographers and a radiologist at one of the Oxford trusts, and they had number of additional lists, number of patients seen on each list, how many additional lists per year, and then you've got the and I put the grayed out bit. This is an old business case, so I grayed out the cost bit because it doesn't imply, they did it because they could then generate additional income. Now this is not necessarily the case under the new payment models. You may not generate any more income, but there's bigger things like reducing the waiting lists, reducing the diagnostic waits. There's all kinds of other performance indicators that are actually really important and need to be addressed. The next stage is what's called the economic case. And this is where you start thinking about all the different options. And the thing I would recommend is taking a step back. Think about all the different things that could that somebody could suggest who doesn't know anything about your service. Your long list should have all the stuff that you would dismiss straight away as a solution because as somebody who's in the service wouldn't work, but somebody who's external might suggest. And they should be part of your long list. So, if somebody who saw this as a problem, but didn't know anything, the details about your service, what kind of things would they suggest as a solution? And that'll be your long list. And what that does is it stops people. It shows that you've thought about it and you've justified why you disregarded it, because a lot of the people looking at your business case won't have the level of knowledge of the detail that you do. So just showing that, yeah, the reason we're not even considering these options is because this. And then you have to come up with your assessment criteria. Now, there's lots of different ways of putting assessment criteria. You'll have your essential criteria, you have your desirable criteria, you have your critical success factors. Okay, and they're your basically your essential criteria. So they're the things that have to be done, and then you have your extra desirable factors. And you may want to weight them. There are lots of different ways of doing it. But you have to have some sort of clear assessment criteria that you're judging those options against, and you have to highlight the key things that are the basics that need to be there. And then you kind of use that to get your long list down to a short list. And you need at least a minimum of 3, ideally 4 options, and it must include a do nothing or minimum option to show that how it compares with everything else. And then you also have to have some sort of, and when we say economic appraisal, we're talking about qualitative benefits rather than money. And then you have to do a separate kind of cost appraisal. And these are just rough ballpark things at this stage. We're not talking about a detailed cost analysis or anything like that. These are just get an idea of the costs involved, because it'll help people then realise, it'll help you and other people realise what level of input and oversight it needs and governance it needs, because the higher the costs, the higher up the chain it needs to go. And also you need to kind of work out who's going to pay for it all, which department is it going to come from, and all that kind of stuff, which budgets are they going to come out of. So that's the economic case. And then you can do an options appraisal. Now, this is a way of doing an option, but there are lots of different ways of doing options appraisal. This is just a potential way of doing an options appraisal. And this is particularly useful if you can't think of shortlist options, or you're struggling to think of ways of coming up with 3 or 4 different shortlist options. Okay, and this is what's in the green book, and it's divided into 3 or 4 different 4 or 5 different areas. And because we've got a mixed group here, I'm going to use something very generic to explain it, and we're going to use HS2 to explain it. So the high-speed railway link. So the problem is under capacity on the railway network between the north and the south, or between the south and north of the country. Okay, that is the problem. There isn't enough capacity, passenger capacity, on the railway network. So the scope could be anything from the minimum is a link between London and Birmingham, where there's the most of a bottleneck. So the biggest bottlenecks between London and Birmingham in terms of capacity. So therefore, the minimum option is to improve our capacity and do some building between London and Birmingham. Intermediate would be to build it between London, Birmingham, and the north west, and then the maximum would be to do London, Birmingham, northwest, and also the northeast. Okay. The service solution of how, excuse me. The service solution of how is the minimum is to refurbish existing lines. So refurbish the existing train network, increase its capacity somehow. The maximum would be to build a whole new line. Okay, so build a whole new line. And then the intermediate is a compromise. It's a bit of both. So some bits are going to be new and some bits are going to be old. Okay, so that's how you go with that. Who is then who's going to deliver it? So is it going to be a local contractor, which is the minimum doing each bit, a national contractor, or an international contractor? And in medicine, it could be, you know, is it going to be a consultant-led network process? Is it going to be a nurse-led process? Is it going to be led by the pharmacists, the allied health professionals? Who is it that's going to be delivering whatever proposal you have? So that's when by who. Implementation is more about when. So are you going to build it? Minimum would be to build it one at a time. So you first do the first bit, then do the second bit, then do the third bit. The maximum would be to build it all concurrently at the same time. And then the intermediate is to do start one, then and then while you're doing that, start the second one and then the third one. So not quite concurrently, but not in sequence either. And then funding, you know, is it going to come from the government, all from the government? Is it going to come all from the tax? As in, is it going to come from increased passenger levy, so on tickets, or is it going to be a mixture? And then what you do is then you go looking at your critical success factors, looking at what you have to justify this. You then go what you're going to cross off. So you just highlight in red, or you cross off each of the things that are non-viable. And then you have your orange, which are viable, and then you have your green, which is your preferred. Okay. And then you treat each line independently. And then you come up with a traffic light system of what is viable and what is your preferred option. You come up with your kind of preferred scenario, and that shows, and you have to justify it, but that shows you've thought about the whole process and you thought about all the different options you can think of. And you've come up and you've decided for these reasons that this is the preferred option, and it shows your thinking. It shows you thought about it in a sensible way. So we talked about strategic case. Is it needed? Why do we need to change? Some of the risks and benefits, and it has to include a quality case. You have to show that it is improves quality. The economic case is all about your choices and what options there are, what option has been chosen and why. I'm going to briefly miss out the commercial and financial case briefly, just for a second, and talk about management case, which is how is it going to be delivered, and that's all about when. And it's all about things like, you know, are you going to pilot it? Are you going to do it in one area first? Are you going to do it in big bang? Or how are you going to implement it? And the impact of service delivery, it's quite it's 4 words, but means a lot of things. Okay, so what's the impact on service delivery of the actual implementation? Okay, so what that means is, what impact is it going to have on other aspects of the hospital? Is it going to interact with other bits that you're not directly involved with? How are you going to maintain services, or what your contingencies for the rollout, for during the rollout? Are you going to have to double run stuff? Are you going to have to have some sort of, you know, some backup? And what would happen if the whole process was going to stall or have to be delayed? How is that going to impact things? Okay. An example of that is, okay, so we've recently gone through a bit of a reconfiguration. So some of our servers have moved sites as we try and do some reconfiguration. So one of the things that has happened last year was that our peds cardiac service moved from our cardiac hospital to our pediatric kind of bit of the hospital, which is, you know, across town. And so what happens during that move? Okay, so what do you have to think about? What you're going to do with your inpatients? What are you going to do with your operating time? But also what you do with emergencies. If you have an emergency during that period, what's going to happen? Now, I'm pretty sure we actually asked one of our neighbouring hospitals, so Birmingham was our nearest peds cardiac centre, to for a period, I think 24 hours or even 48 hours, to take over or deal with any emergencies during that period of time. And in a similar vein, we did the same thing with renal transplant and renal service. So what's going to happen during that time? You know, if somebody comes in while you're mid-maneuvering, what are you going to do? Where are they going to be treated? Is it going to impact patient safety negatively? Okay, so you have to have showed what's going to happen. And it's better to have thought about it now than to get it all approved and then have to think about it then, because that might have incur extra costs which you haven't been factored in. Okay. Now I'm going to briefly touch on some of the other bits, which is like things like the commercial cases. So the procurement process is it's well worth getting your procurement colleagues involved, because the procurement regulations, depending on particularly the higher the amount of money involved is, it gets more complicated about putting out to tender and all that kind of stuff. So there are limits. There's capital or procurement limits as to above which things have to be put out to tender, and then that becomes a whole process in itself. Personnel requirements. The other thing about procurement is when you're looking at the cost of something, you have to look at the whole life cost of something. And by that I mean there are some. I'll give you an example. So we use these fibre optic intubating things, bronchoscopes, little camera things, to help us intubate, and most of them are disposable nowadays because of the cleaning costs. So if one company offers us will give us a camera for say £200, but it has to come with, you have to buy a screen. You have to have a screen to visualize it, but the screens cost the screens are free. No, screens cost £50. Another company will let me make sure this is the right way around. So one company will give us the cameras for £150 and the screens cost £50. So the other company will give us the camera for £200, but the screens are free. Now, which one's going to be more worthwhile over the lifestyle, for us as an organisation, will depend on how much we're using it. Okay, so if we're only using it 4 or 5, 10, 20 times a year, then you're probably going for the cheaper kind of consumable, the £150, and then pay for the screens extra. If we're doing, sorry, if you're paying only 10 times, you're paying over the higher consumable and getting the cameras for free. If you're doing 150, 200 uses, then you're betting off getting the cheaper consumable and paying for the screens. I hope that makes sense. I kind of lost track of my thoughts there. But also, it's worth making sure that you have a realistic expectation of the lifespan. So there's no point signing up. So we would never sign up for a 10-year contract for these things, because technology improves so quickly. There'll be a next iteration of it in 5 years, and all my colleagues, including myself, will want the latest something that's 10 years old. So be realistic in your expectations of when you're likely to upgrade, so that you can have you can work out the cost over that lifespan. Okay, there's no point being tied into a contract for things that you don't really want to use. And they often come with a minimum, the rate that they're giving you is based on you using a minimum number of product or consumables. So just be wary of that kind of stuff. Personnel requirements. So when you're doing business cases, you tend to use a 37.5-hour working week for people on the Agenda for Change contract, and a 42-week year for consultants, medical teams, because it's just the easiest way of generating it, in terms of, so an extra nurse 7 days a week is like 2 or 3 working time equivalents of personnel. So it depends on exactly, work with your HR to work out what that works out in working time equivalent, so you know how much it's going to cost you and what kind of level. So normally for consultants, you start you budget, or you kind of pitch it in terms of your costs for the mid consultant salary, and then you're probably worth, for a band 5 or band 6, you go for mid-level, but HR will give you the numbers that are the relevant numbers for each one. So those are kind of things, that the quirks that you don't always think about. And finally, the contract issues. It's important to be aware that if you're already signed into contracts for equipment, it's very hard to change their contract unless there's been particular patient safety issues, or there has to be some sort of technical fault with it to kind of change contract, to change mid-contract. And so normally, if you know that somebody's going to contract's going to end in a year, start the process of assessing and looking at what you're going to replace it with, a year before, because it does take time. You don't want to have a gap in provision. Other things are, there may be compatibility issues because of contracts. So we bought a cardiopulmonary exercise testing machine, which is basically an exercise bike with fancy monitors that attaches into a computer and gives you a readout. Our managed IT services, I don't know, I still don't know which one. I say it's with HP, for example, Hewlett Packard, but the computer that comes with the kind of equipment is a Dell. Now, because for various reasons they can't update the they use certain proprietary software to update the computers and maintain them, meant that they couldn't update that particular software, which meant that there was a security risk, which meant that they couldn't connect it to the network, which essentially meant that we had to take out that computer and replace it, which then caused problems with the sensors, and it basically caused 3 or 4 month delay having bought it before we could use it. So just things to be aware about, in terms of the contract issues involved and conflicts between equipment. So there are a few little bit of things to think about. Other things, present your ideas before you submit the business case. Get somebody on the board to have a look at it and see what they think, just because everybody has different weightings and different perspectives on these things. Try and involve as many people as you can, in terms of anybody that's got a vague, call them stakeholders, but anybody that may be impacted by your business case. Get them involved in the business case, because then they'll less likely to put up barriers. So address their concerns, incorporate their suggestions, get their support. So that's probably one of the big things. Other things are timing is important. You may find, and this is by no means a guarantee, that small business cases tend to do better near the end of the financial year, because often different pots of money that are slightly surplus. There's quite a lot of surplus money, particularly in COVID funding at the end of last year, and new services funding is better off starting from the start of the financial year, but you've got to remember that contract discussions may start as early as the previous, September, October. So try and get things on board to start in the following financial year, and that there's more likely to get approved. Think about appropriate sources of funding. There's various digital transformation funds and education funds out there. As I said, we got our funding for our e-consent and e-pre-op assessment from NHS Digital. Other people have got funding from education budgets that often have bits of money that are ring-fenced particular uses, but so they can't be spent on other things, but often don't get tapped up as well as they should. Think about specialised funding, specialised commissioning funding. So our we do a prehabilitation service. Wasn't actually anything to do with me. So that looks at programmed exercise for people before major operations, and we got our funding from NHS England for that, because the operations that are that this benefits are the big cancer operations where which are funded by, at the time, NHS England. So they are the ones that funded our prehabilitation programme. So just look at who's going to benefit the most out of your project. Other things to do are combine smaller business cases with bigger business cases. If you know there's a big business case and there's this bit is a relevant bit of it, then combine one with the other. So we are, as I said, I'm sustainability lead, so we're looking at putting in various filters to break down some of the various gases that we use, nitrous oxide and things like that. But I know that we're refitting our ventilation, and we are building potentially a new maternity hospital at some point. And you're much more likely to get approval for that as part of the bigger business cases for ventilation and the new hospital than I am to try and do it as a standalone business case. So there are different ways of trying to get your project funded. Just some generic poor business case examples. Things like this mean nothing. This was something I found in one of our bids, and on this timeline there's no needs to be quantified. Are we talking weeks, months, years? Is perioperative care impact a good thing or a bad thing? Not really sure. It doesn't mean anything to me, and I'm an anaesthetist that works in this area. It means you'll mean even less to somebody who doesn't know about that. Again, it has to have context. So this is for a pre-op assessment pathway. It doesn't actually have the pre-op assessment in the pathway in terms of how the digital, what impact the digital program software is going to have on it. So it has that context. It has to mean something. This was taken from something else actually, and just copy and pasted into the business case or the bid. Previously, I've been asked, and you'll get this in your slides, that what are the current oversight frameworks, so your KPIs, and these are links to the kind of oversight framework and the KPIs that you'll get. And there are some templates and support material from the Treasury that give you, very similar to what I've said, but in a slightly different way of pitching it. Okay, that is my whistle-stop tour of business cases. It is very much a whistle-stop tour, but it hopefully gives you some insight into how a business case should be written, could be written. The offer the standing offer that I have is that I'm happy for anybody to send me any business cases that they want me to have a look at, and I'll just give you some feedback, good, bad, ugly. But that's an offer that is there at the moment, at least until I get overwhelmed by it. But but haven't yet. Feel free, email me if you need to. You've got my email address. Any questions on any of that so far? Yeah.
Hi, AK. Thank you very much. My question pertains to the key stakeholders that you mentioned, all those people that would not be barriers to change. With respect to business cases, you always get the key personnel involved, you know, your finance, your charity managers, your divisional directors, but a lot of things which may ensue after the changes happen always tend to sort of center upon quality, risk, governance. So how important is it to have a quality and risk and safety lead involved in your business case right from the outset?
The more people you can get involved, the better, generally. In terms of whether you get somebody involved or it depends on your setup. So if you have risk managers and stuff that are willing to participate, then by all means get them involved. You know, I know that we have a lot of risk management from in-house in terms of, you know, we have other people in our department that are leads for, you know, risks and have got experience in that. So we try and get them involved to have a look at stuff.
Okay.
So it depends on the exact nature of the business case and whether, you know, there are some things which have obvious quality improvement aspects of it, and you don't need to go worry about the kind of quality improvement metrics and stuff like that as such. But in other areas, risk is a big thing. You know, generally. So somebody pitched me there was a radiographers. They had a different way of doing breast cancer screening, which involved cannulation and some sort of different technique of doing it. Now, the biggest risk I saw for that is that takes longer than the standard mammogram. Okay, so that's going to impair your throughput in a session. So you have to factor that in to when you're putting your business case in, because actually that's going to negatively affect your 2-week weights and your mammogram screening program and all that kind of stuff. So that is a risk. So unless you increase your capacity or the number of sessions you provide, that's going to be a big risk. So it depends on whether you can think of the risk yourself or whether you want somebody else to help you identify any risk that you haven't seen. You see what I mean?
Okay, thank you.